after going through 3 surgeries, 2-month hospital stay, 5 months of rehab after, you learn so much about what it is to really be a patient. And in healthcare, we get a lot of good training on bedside manner, but there's just something different about actually having lived that experience and being able to, like, I know what it's like. I know where things can go wrong in the hospital. I know where you have complications from things and you stay longer. And all the horror stories that can happen to you in the hospital, most of those I experienced, even though they knew I was a physician. So coming out of that and dealing with family and friends who were taking care of me the entire time, I just started to learn about the patient and caregiver interaction. And it just opened my eyes to a whole new sector, a whole new niche group of people within healthcare that aren't actually being served, that are overlooked. And it's not intentional, but it's just because of how healthcare is set up to treat patients, which it should. And because of that focus on healing patients and making patients well, we actually neglect the people around the patient. And I would notice that during all my visits, all these follow-ups. And mental health was never addressed, family was never addressed. And it just shows you that blind spot in healthcare that we miss. So when I went through my experience, I had to look and say, okay, these are all the things I was dealing with. This is why I was doing these things. These are the things as a patient that I wish caregivers knew. These are the things that caregivers wish their loved ones knew. Then it was putting it together. It was studying the caregivers I had come across as outpatient in the hospital, and then going through questions that I would see needing to be asked. How are you feeling about your quality of life? Do you feel like your life has gotten worse? Do you feel guilty when you take time for yourself? Do you feel like you're the only one taking care of you? All these questions that a lot of them haven't considered because they're working so hard. They're trying to do everything possible out of love. They're burning themselves out on the caregiver end. And just looking at it from a caregiver standpoint, taking care of a grown adult, managing a lot of their affairs, you're carrying the emotional trauma of seeing them suffer. Then you have the self-neglect that comes with that. It was just a big blind spot. And I knew that something had to be done to care for them as well. We can't leave them behind because eventually the patient gets better, or if they don't, there's still life after that. There's life after the diagnosis. For the caregiver, what's that life going to be? And why is no one focused on it? Because making sure they're well improves patient outcomes too.
For us, by us, and just for us, this is Hope for Med.